Feel that scratchy throat coming on or an itchy rash and you just don't have time to go to the doctor? I'm Angie Moreschi. In today's Consumer Wise Report, we'll take a look at telemedicine, the growing trend of talking to a virtual doctor on your smartphone or your computer. Stay with us.
Ooh, I don't like the sound of that. Let's see what the doctor says.
This Tampa General Hospital video shows how easy it can be to check in with a doctor on the internet through an app on your smartphone or computer.
It's fast and convenient. You don't have to take maybe 3 or 4 hours off from work to get in to see a doctor.
TGH is teaming up with national telehealth company American Well to provide doctors for the service. You download the app, then fill out medical information and a credit card number for payment. When you log in, you get access to a virtual waiting room with several doctors seeing patients. You can check out their bios and see if they have other patients waiting. Then you pick one. The average wait before they see you is under 10 minutes.
It's very similar to a regular doctor's visit. We talk to them first and then we perform a physical exam, which is the part that's different.
Can you open your mouth?
The doctor examines you through the camera or phone on your computer.
If they're having a rash, I may have them take a picture of the rash so that I can get a better look and they can upload the picture.
The most commonly treated problems include sinus infections, sore throats, pink eye, and more.
Hi, how are you feeling today?
The virtual doctors are available 24/7. They can treat minor problems and send a prescription to your pharmacy for most things, although not controlled substances like painkillers.
It's a real convenient way for patients to receive medical care wherever they are.
The virtual doctor visits are convenient, but understand they're not for serious traumas or emergencies like chest pain or possibly a broken limb. To handle those, you'll have to do it the old-fashioned way, seeing a doctor in person. I'm Angie Moreschi. It pays to be consumer wise. Concern over patients getting infections in the hospital is a big deal. So what can you do about it? I'm Angie Moreschi. In today's Consumer Wise Report, we'll take a look at new research and practices here at Florida Hospital Tampa that are making a big difference. Stay tuned to see what you can do to protect yourself.
How are you feeling today?
I am feeling completely wonderful.
Advanced GI surgeon Dr. Alex Rosemurgy has zero tolerance for hospital infections with his patients.
Patients with cancer who get an infection are less likely to be cured of their cancer.
That vital fact led Dr. Rosemurgy and his partner, Dr. Sharona Ross, to launch new strategies to reduce infections at Florida Hospital Tampa.
We changed the air handling system. We changed the way we bring people into the hospital. We changed pre-operative processes like the way patients prep themselves.
Before surgery, every patient is given a prep kit with a protocol to follow the night before surgery. First, they have to swab their nose with iodine, then rinse their mouth with an antimicrobial agent, and wash down their body 3 times with that same antimicrobial before the operation.
Germs are relentless, and this just made me feel so reassured.
Get the robot set up here.
The results for complex pancreatic cancer cases, impressive.
We brought our infection rate down by half. So it was already half of the national standard, but we brought it down by another half.
For some less complex cases, the results even better. No infections for an entire year. That led to a hospital-wide program called Chasing Zero.
I think it's wonderful. I think it's completely reassuring.
So be an educated patient and learn from these simple protocols that can help reduce your chances of getting an infection. And be sure to ask your doctors what they're doing to reduce the chance of infection if you have to have surgery. I'm Angie Moreschi. It pays to be consumer wise. Acne is the #1 skin problem in the U.S., and whether you're a teen or an adult, you know it can be tough to treat. I'm Angie Moreschi. In today's Consumer Wise Report, we'll sort through all the different products to find out what really helps to clear your skin. Stay with us. Looking at her beautiful skin now, it's hard to believe, but Divya Sadwani had a long and difficult battle with acne.
I first started experiencing acne around the age of 13.
Countless products pledge to clear skin, but getting results is not always easy.
One of the simplest things is a salicylic acid wash, 2% salicylic acid wash.
Salicylic acid exfoliates and helps treat the #1 cause of acne, clogged pores. But for many, it's not enough.
This is a benzoyl peroxide.
Benzoyl peroxide helps to kill bacteria on the skin, which can cause inflammation and cystic acne.
Everybody with acne should be on a retinoid, a vitamin A acid derivative.
You need a prescription to get most retinoids like Retin A or Epiduo, a more recent go-to for dermatologists. Epiduo contains a topical retinoid called adapalene mixed with benzoyl peroxide. The problem, it can be very expensive, more than $400, and insurance doesn't always cover it. The good news, you can now get that key ingredient, adapalene, in an over-the-counter product called Different for just $30. You mix that with an over-the-counter benzoyl peroxide and you mimic the treatment. Prescription antibiotics are also often necessary for difficult cases.
I needed to add on antibiotic creams, and also I use a topical retinoid at night religiously.
Let's take a look here.
Today, Divya is not only an acne patient with results, but also a dermatologist treating acne patients.
Dr. Sidwani, nice seeing you. It really does affect your self-confidence. They just need to have hope.
Finding the right product to treat your acne is a process of trial and error. It can be tough, but if you're diligent, in most cases of acne, you can find an effective and relatively affordable solution. I'm Angie Moreschi. It pays to be consumer wise. If you suffer from heartburn, fried foods like this are a no-no. But a lot of folks turn to common medications to help their heartburn. I'm Angie Moreschi. In today's Consumer Wise report, a new study says that could put you at risk. Stay with us to find out some alternatives and give you some options. Dolores Dean suffered from chronic heartburn for years.
It was awful. It's just heat bubbling up.
She took proton pump inhibitors like Nexium, Prevacid, and Prilosec to help stop the acid production in her stomach.
Anything to try to help.
But now a new study says long-term use of those drugs could increase the risk of early death.
That is very scary.
Dr. Sharona Ross says the recommended dosage for these pills is generally only 4 to 8 weeks, but many people take them daily for years.
When the drugs, the proton pump inhibitors first came out, it was like the miracle pill because it was an operation for acid reflux or this magic pill that took away all the symptoms.
Now the list of potential risks is growing, from early death to kidney disease, bone fractures, and dementia. Time to consider alternatives. Your first line of defense if you have heartburn: change your lifestyle and your eating habits. Figure out what your trigger foods are and avoid them. And if you're heavy, try to lose weight.
I take that upper part of the stomach and wrap it around the esophagus.
If lifestyle changes don't work, you can get tested to see if you're a candidate for a minimally invasive operation which corrects the mechanical problem that creates reflux.
This is what you had, and that's what you have now.
Dolores had the procedure and now is back to enjoying eating heartburn-free.
It's great. I love it now.
Bottom line, be careful about using heartburn drugs or any drug long term. Make sure that there is a clear medical benefit that outweighs the risk. And understand, for heartburn, there are alternatives you can explore. I'm Angie Moreschi. It pays to be consumer wise. The popularity of plastic surgery and cosmetic procedures continues to grow every year. I'm Angie Moreschi. In today's Consumer Wise report, we'll take a look at what the top procedures are and who's getting them done. Stay with us.
Flat tummy, narrower waist. She's lost the line across the middle.
Plastic surgeon Dr. Dan Greenwald says cosmetic procedures are becoming more popular than ever, especially mommy makeovers, which generally include a tummy tuck and breast augmentation.
People's bodies change when they have babies. Their breasts change from the effects of pregnancy and or breastfeeding, and many tummies don't become flat again.
There were 15.6 million cosmetic procedures in the U.S. in 2014, up 3% from the year before. Brittany had breast augmentation.
Increased size to my breasts, I thought, just added a whole nother level to me, and I just feel more confident and everything.
Another significant trend we're seeing is injectables like Botox and fillers. They're not eliminating the full-blown facelift, but they've definitely taken over in popularity to help smooth wrinkles on the face.
Here we go. 1, 2, 3, pinch.
Not only are more women getting injectables, but men too, especially Botox, or Brotox as it's called, up 7% for men in 2014.
My eyes are super sensitive to light, so I'm constantly squinting and making funny faces and doing weird eyebrow things, and it makes bad wrinkles up here, and I usually have like a furrow in the center, and it completely got rid of it altogether.
The most popular surgical procedures: breast augmentation, nose reshaping, and liposuction. For minimally invasive procedures, it's Botox, fillers, and chemical peels. If you decide to have any plastic surgery or cosmetic procedure, be sure to check the credentials of the doctor or nurse first. Ask how many times they've performed that procedure and ask to see their before and after pictures. I'm Angie Moreschi. It pays to be consumer wise. If you have to have surgery, finding the right surgeon is one of the most important decisions you can make. I'm Angie Moreschi, and today's Consumer Wise Report, advice on how to make a good choice. Stay with us.
How are you doing?
Feel great.
Dr. Sharona Ross is a general surgeon at Florida Hospital Tampa and says patients should never take choosing a surgeon lightly.
This is a physician that is going to put a knife in their hand and going to cut you open, okay? I mean, this is important.
One of the first things to check is whether the surgeon is board certified in the specialty related to the procedure you're having done. To find out, you can go to the American Board of Medical Specialties Certification Matters website. It's very easy. You just type in the doctor's name and hit search, and it shows whether they have any specialties and if they're up to date. What was most important to you in finding a surgeon?
Their success rate.
There we go. Your surgeon's success, failure, and complication rates are key questions, and most often that relates to experience doing the procedure.
If you do a specific operation a lot, your outcomes are much, much better.
It's also important for surgeons to use best practices and be up on the latest techniques.
Are they doing research? Are they publishing? Are they giving talks in conferences? That looks great.
Most important, be informed. Surgeons should welcome your questions.
Nobody should be intimidated by their surgeon. It's very important to be engaged, to be knowledgeable, and question your surgeon. The more you know, the easier your recovery is going to be.
Even relatively simple surgeries like gallbladder removal and hernia repair can cause serious complications, so don't take it for granted. Ask the right questions to make sure you're in good hands. I'm Angie Moreschi. It pays to be consumer wise.